Hi, I am Carrie Langstraat. I'm a gynecologic oncologist at the Mayo Clinic in Rochester, Minnesota. My research project centers around the use of artificial intelligence to assess ultrasound imaging to try to better distinguish benign from malignant masses in patients that were found to have an adnexal mass. The funding from FWC has been crucial for us to get this project moving. The funding has allowed me to employ a data scientist and an AI expert to move forward with this project. So we work closely. We have a big team. I have a PhD, Dr. Tim Klein, who specializes in AI, and we also have a programmer, Adriana, um, who's also been working and helping us analyze the data. The grant has also allowed us to generate some preliminary data to move forward with additional grant applications. And we've gratefully been awarded additional funding support that will go on to continue our project after we complete the FWC grant. To create these AI models, we need a significant number of patients. So right now we have analyzed about 200 images, and this will allow us to kind of create a proof of concept to know that it is feasible to use AI to discriminate these types of lesions. Moving forward, we anticipate that we're going to need thousands more images and patients. And that we will also need to reach out to other centers so that we can ensure diversity within our patient sample. So what we see on the horizon is that we will begin partnering with other institutions, generate additional data, and hopefully validate the model which we have created with this baseline funding that we have received. So our current standing is that we have segmented and loaded all 200 images. We are actually working right now on developing the algorithm to discriminate those lesions. So hopefully in the next 2 weeks, we will have some preliminary data that we will be able to share with our grant update in March. Adnexal mass is one of the most common indications for us to see patients in gynecologic oncology as well as in gynecology. And we rely on expert radiologists to help us determine, does the mass look malignant? Does the mass look benign? And expert radiologists aren't available everywhere, unfortunately. Hopefully, if we can identify an algorithm with AI, we will be able to deploy this resource nationally and be able to affect specifically patients in low resource areas. So specifically in my practice, I see patients that travel 6 hours, 8 hours for surgery. And potentially those are patients that could have surgery closer if we really felt based on an AI algorithm that they had only a 95% chance of it being benign. So I'm hopeful that this technology will, one, allow us to better discriminate patients before they even hit the door, so we can have those patients that really need gynec travel and have those patients that can have surgery locally stay local for their surgery. And then secondly, we hope that development and further development of this technology will help us find a screening test for ovarian cancer in the future. So I had a patient that came down overnight. She'd been seen in the emergency room about, up in the middle of North Dakota. So she had about a 6-hour drive down to see us. And the ER physician did an ultrasound and said, "You have ovarian cancer." And this patient immediately jumped into her car, drove overnight to come to see us without an appointment. And, from meeting her, she's teary-eyed, frustrated, anxious, and, incredibly scared, as any patient would be if they were given this information. But when I look at the images, I could look at those images and tell her in clinic, I really think that this is not a malignancy. And, I think just the relief on her face and the feeling like, oh, we could have saved her all of that anxiety and all of that panic if we had a better test or a better way of screening her ultrasound before she even had reached our door. And maybe it would have prevented that emergency medicine physician from saying you have ovarian cancer. Maybe they would have been able to say, you know what, this, looks like an adnexal mass, but based on our AI algorithm within our ultrasound technology, it's very low likelihood that this is malignancy. So that's really what has motivated me is the patients and my worry for them traveling so far and taking time away from family and work just for treatment that they maybe could have received closer to home. I would really like to thank the National Ovarian Cancer Coalition for the funding that they provided me, as this really was kind of the catalyst for us to move this project forward. And I'm really excited to see where it goes.